This is live from my office, Steve Cochran. I'm glad you're here. I appreciate it. I hope you have survived early 2021. I'm going to be honest with you. I refuse to call it 2021 yet. I want a clean break, and we haven't had it. After January 6th, there is no clean break. So New Year's Eve for me is Wednesday the 20th. Biden's inauguration is Wednesday afternoon. New Year's Eve is the 20th. The 21st, or I should say, yeah, it is the 21st. Oh, and look at the date. The 21st is Thursday. And 2021, oh, there's some numerical coolness going on there. So Thursday is New Year's Day. That's when I'll start calling it 2021, with, of course, reserving the right to change again because, oh, what a knucklehead time we live in. So let's just call this 2020 continued. And the inauguration of the new president is this Wednesday. The potential permanent ban from federal elective office is going to start as soon as about 15 minutes after the inauguration is complete. Look, we're counting on the best and the baddest 25,000 of us to keep not just Biden safe, but to keep the ceremony safe for the important symbolism it sends to the country and the rest of the world. Personally, I would like to see this inauguration done indoors. There's no win here in the big picture, but there's a lot to lose. America will not look at the Biden team as ducking and covering and kowtowing to terrorists. The terrorists won't look at this as, well, they stood up to us now, we're going to go away. So I hope that there is an 11th hour reconsideration of it, even with all the confidence in the world that this can be kept safe. After all, we're already looking at 25,000 service members, police officers and the likes, and there's going to be more. The official number really, frankly, isn't known, that have locked down D.C. And don't forget, a lot of people still live there. So God bless those folks who are in charge of taking care that the people who will be in charge of this country and all the others in attendance on Wednesday will be safe. And I'll tell you the same thing I always tell you. If you see something, say something. That is, if you're aware of a Facebook post, an Instagram post, a tweet that is frightening to you, you got to let somebody know. And start with your local police department. You can always report it anonymously. All right, we thank Team Hochberg, our title sponsor for Live from My Office, 855-56-DAVID or 56david.com. As far as President Trump goes, he could make these last 3 days possibly the best 3 days of his entire presidency if, in fact, he said what he should say. He, of course, won't. In COVID-19, well, that's a big part of what Joe Biden wants to take on as soon as he takes the oath of office. Let's run through a couple of the things that we now know are going to be done by executive order right out of the gate to kick off his first 100 days. He wants 100 million shots in arms in his first 100 days. Dr. Fauci says it's possible, and so does our guest today. More on that in a second. For housing, he wants rental relief and eviction foreclosure protection until September. He wants to roll back about 100 environmental rollbacks. He wants to flip them back to where they were, including rejoining the Paris Climate Accord. For immigration, yeah, the immigration system does need an overhaul. That's an absolute truth. But how it's done is crucial. And Biden's going to see that no more wall is built, families will be reunited, and immigration reform in a proper way will be done. Corporate tax hike is absolutely coming. The stimulus checks he wants to get out, $1,400 in addition to Americans, will be argued about, but it'll happen, and more unemployment help as well. And when it comes to guns, banning assault weapons, of course. You know, they weren't invented when the Second Amendment was written. So the Second Amendment wasn't about them. And all this nonsense that has been spewed about guns in the past many years, about high-capacity magazines, and you're being entitled to it. Shut up. You're not entitled to any of it. Your Second Amendment rights aren't going away. And you know what? They shouldn't go away. But stop exploiting the Second Amendment to things it was never intended for. Oh, and congratulations, NRA. I hope you enjoy your bankruptcy. One of the other things that gun laws are going to be changed in regards to this new Biden administration, what they plan to do, is requiring background checks for all sales of guns. No more gun show loophole. its background checks, or you're going to be in trouble. I mean, think about what you have to go through just to get your driver's license and renew your driver's license, or to get a motorcycle license, or to drive a truck professionally. You do more to buy antihistamine at Walgreens than you do in some cases to buy a gun. It's got to stop. The Affordable Care Act will be continued, and lower out-of-pocket expenses is the goal. Biden says he could get it done. Meanwhile, Donald Trump is behind closed doors and really for the past month has avoided being president, as opposed to whatever facsimile of a presidency he had before. He does, however, want to raise $2 billion for his Donald Trump Library. Just the title makes me laugh. And, of course, in the Trump Library, you'd have things that are representative of the administration and his years as president, as well as the span of his life. So I'm recommending a hall of hookers, a place where we could all examine all the women he paid to have sex with. Possibly a documentary film. All these presidential libraries have films about the president that they are honoring, and we could call his maybe A Bankrupt Life, from the businesses that failed to the country he nearly destroyed to the lies he told to get there. I think I just invented the subtitle to all of it. Maybe I can narrate it. And then I like a virtual reality sort of thing where Trump, as an animation of some kind, walks through his life. We'll call it the Walk of No Shame. And honestly, should you have a library if, in fact, you've never been in one, Mr. Trump? We have a great guest today, and if I were still doing the annual Stevie Awards, he would absolutely be the best guest of 2020. It's Dr. Kevin Most. We're going to talk about whether or not Illinois, where we do Live from my office, is getting it done by way of making sure there's a plan so we know when we get in line for the COVID-19 vaccine. There's a lot to be answered for who's getting it done, who's not getting it done, what must be done, and how we get in line. We'll get to all of that with Dr. Kevin Most when we come back. I'm Steve Cochran. I'm glad you're here. Check the show notes before you go and rate and review this show, along with following me on social media and check it in on email if you like. All on Live from my office. You need to do what we do. When we need Team Hochberg's help, we do this crazy thing. We call him. He's your trusted local lender. And David would like to thank you for allowing Team Hochberg to help you, your friends, your family, your coworkers with a mortgage in the past year. Team Hochberg funded over $355 million in refinance transactions, helped listeners secure lower rates, shorten the term of their loans, pay off debt, and save listeners over $275,000 a month. My daughter and one of my sisters used Team Hochberg in the last year. By the way, it's the second time they've done it. Maybe the third. Team Hochberg, and you know what? I've used Team Hochberg multiple times. Well, you knew that. Team Hochberg also helped listeners purchase over $88 million worth of new homes, second homes, and investment properties. When the pandemic hit, Team Hochberg helped listeners understand the importance of and explain how to take advantage of forbearance. That's that term that came up so big in 2020, and using that forbearance to save their homes. Point being, if you have a question about anything related to the fog that comes over you when money's being discussed, you're not alone. We're all like that. Get a hold of Team Hochberg. They help me. They help thousands of my podcast listeners, and they're going to greatly appreciate the opportunity to help you secure a mortgage this year. But they can't help you if you don't call. You know what I'm saying? I can't call for you. David can't call you at home. He doesn't know where you live yet. 855-56-DAVID or 56david.com. And tune in to Home Sweet Home Chicago, hosted by David Hochberg, Saturday mornings at 10 a.m. on WGN. Homeside Financial, an equal housing lender, NMLS number 1124061. This is Live from my office, and my friend Dr. Kevin Most joins us in the midst of all the political news and this bizarre continuation of 2020. I refuse to call this 2021 because I want a clean break for the year. 2020 continued. It's amazing how little talk we're hearing about COVID, which should be the number one news story and the number one thing on everybody's mind. Understanding the fatigue, but we've hit 400,000 dead in this country. And Dr. Most, there's got to be some light at the end of the tunnel soon. So give us the light.
Yeah, the light is, I think the light's two things. People in Chicago are very fortunate. They may be upset with the governor and the mitigation of that efforts that he's put in place. But when you look at us and compare us to what's going on in Georgia or Arizona or California, we're obviously in a much better place. So is the light at the end of the tunnel that we might open up some businesses or expand businesses? Yes, I think that's one. But probably the bigger one is going to be the vaccine. And everyone's seen the stories on the vaccine and the upset. I just tell them, be patient. That things will change, and I think they'll change pretty rapidly here.
So the vaccine distribution plan of this, Vice President-elect Biden came out the other day with a very aggressive plan. He's doing what you've been advocating since last March. Get someone in the military who can step up and be the point man in all of this, so the logistics are handled. The logistics piece of this, is that why the delay has been what it was, even though the vaccine exists, or where's the breakdown?
Yeah, I think the breakdown is two places. One is the supply side of it. So everyone's talking about, boy, we've depleted this national source of vaccine. We all have to remember that right now the vaccines we're dealing with are 2 doses. So in the state of Illinois, we got our doses, we allowed the first dose to be given, and the state held back those second doses, which was smart. Some states didn't. So the issue really is going to be distribution and supply. So, President-elect Biden saying 100 million doses in 100 days. So 1 million doses a day. People say, oh, that's possible. Well, we also have to remember the logistics of this. It's actually not 100 million doses. It's 200 million doses because they have to get that second shot in. And then you also have to remember that, okay, we're going to have these mass vaccination sites that we're going to do this, which is great. On day one, that's perfect, right? You give out your doses. But when you get to day 21, you need to have doubled that workforce in order for these to be just as efficient, because now you're going to have people getting their first dose as well as those getting their second dose.
Right.
So, here in the state of Illinois, Governor Pritzker is really pushing health systems to say, hey, we don't want this to be like Florida, where we have seniors waiting in line for 8 hours to get a vaccine, only to get to the front and find out that there's no vaccine left that day. What we really want is more of an organized. Let's organize it from the physician level, send out messages, get appointments. So make sure that it's more streamlined and efficient than the inefficiencies that you're seeing on some of the news shows now.
So the inefficiencies that we see and the lines that people are dealing with, the only way to speed those up is more bodies. If the supply chain is working, where do the bodies come from?
Yeah, there's two things there. It's more bodies and it's organization. Just give you an example. For us at Northwestern, at Central DuPage, we got it down to where we could do between 200 and 250 people an hour.
Wow.
So, yeah. And we did it smoothly. Now, that was probably by the third time we ran the clinic. We found efficiencies as far as drawing up the vaccine, how to do it, having a traffic person kind of telling you what site to go to. So that's one thing, is the logistics. Now, if I know that I had going to give out 200 in the first hour, now my line is going to be much shorter because I'm going to move those through. I'm not going to have 5,000 people in line knowing that I'm going to be able to do 5,000 doses in a day. I'm going to have the 7 o'clock to 8 o'clock people there. We're going to move them through quickly. The 8 o'clock to 9 o'clock people are going to come. So it's just kind of a workflow. But you're absolutely right about the individuals. Who's going to put the needles in the arm? National Guard? Absolutely, if we can roll those people up. But a lot of people also have to understand that when we pull from the National Guard, we're actually pulling from hospitals in most cases. The individuals that are in the National Guard have another job for the most part. So we have to say, oh gosh, we're using the National Guard. Yeah, but that's probably pulling from the hospital sources as well. So we really have to make sure we can balance the nurses, medical assistants, whoever can give those vaccinations, and make sure that we do it in an efficient way.
Is emergency training of civilians to do this impossible?
Yeah, it's not impossible. I'd say one thing we'd have to get approval because obviously you need to show competency that you can do it, that you're giving it in the right place, that you know how to do it. But I would say more importantly is we have this number of nursing students that many of them already have their bachelor's, many of them are working towards their bachelor's and are doing this, and we haven't expanded it to them yet, which certainly is something we should do. That way, we're not training somebody that we're training for a short period of time and then they're leaving. This way, we're giving experience to a future nurse, and they're not only giving the shot, but they're able to look for and act if an adverse reaction occurs.
Well, what about retired nurses, even if they've been retired for a long time? I know we don't want to bring in folks who are in the greatest risk category of 65 or even 60 plus, but these are dire times, and if folks are willing to do that, is that a possibility?
100%. Matter of fact, one of our stands was that the vaccinators are vaccinated. So they get vaccinated first before we actually, use them. Many nurses retired just recently because of COVID, because of the exposure, because of the risk. To bring those individuals back would be very easy. Many of them maintained their license, so they kept their license intact. And you're talking about now experienced nurses. You had experienced ER nurses that said, you know what, I don't want to take this risk of getting COVID. I've had a great career. I'm going to retire. Those same nurses, though, bring them back and put them in an environment where they're not being exposed to COVID patients, but they're immunizing, is absolutely something that every health system should be looking at right now.
So would this be a state political thing that would have to be approved, a federal thing? How did that work?
No, that would be a state thing. So it's kind of interesting. The distribution was from the state. The initial distribution went to all the states. Then the states kind of decided what they were going to do. Here in Illinois, Governor Pritzker took it and went from the state down to the county level. What's going to happen going forward, I'm not sure. I'm not sure whether he's going to keep it in the county level, whether he's going to keep more control of it and just work with health departments. So it's kind of up in the air as far as that portion.
And of course, politics moves ridiculously slow, but with the change in administration federally, I would assume there'll be more pressure on the states to make sure they have their acts together, regardless of who's in the state house and the state governor's mansion. Is that the way you see this getting better, trickle down from the top?
A little bit. I think more on the federal level, at least initially with the Defense Production Act. We're using more syringes, obviously, than we've ever used or that we ever would have planned to use. So we have to make sure we have syringe production. We have glass vials. We were not planning on making all of these glass vials for this. This is brand new. And then the vaccine production. So all of those would come from a federal portion of the Defense Production Act because when we're looking at number of doses, it's a multiple of what we have. So once we know we have enough vaccine and we can do it right, then it's just a matter of us with the logistics. And certainly there'll be some pain, but we got to get through this, right? And we have to get through it in the right way in Illinois here. And I think it's going to be a lot different than what you've seen across the country.
So when you have your meetings that you're in all day, what is the number one concern or maybe the top three concerns? Like if I said to you, Dr. Kivamos, you're in charge right now, what are the three things that have to get done?
Yeah. So probably the biggest one is how are we going to do mass vaccination? So we have proven at the hospital-based level, like I said, we had clinics where we're doing 2,000. Now, we're not doing those every day. And you have to remember, we're pulling nurses down from the floor for a couple hours to give shots, and then they're going back up and finishing their shift. So one of the things that we have to do is, where are those going to be done? I can tell you there's not a hospital in Illinois that could handle 500 cars in their area. So we really have to figure out, are we going to be doing these in high schools? Are we going to be doing them broadly in all of the pharmacies? Now, you've been to pharmacies. It would be very inefficient to do it there just because, like I said, we can do 2,000 in a day. You can imagine at a Walgreens, giving someone a shot, making sure that they watch them for 15 minutes. How many can you even put through in a simple day? But you have breadth there as well, right? Because now we might have hundreds of Walgreens. So hopefully at the state level, we're looking at a broad-based, get it out of the hospitals, but leave the hospitals in it somewhat because we can do it very efficiently. But it really is going to come down to someone has to be the leader to take this over and say, this is the plan for the state of Illinois. We're going to do these in Walgreens and CVS's. Hospitals, this is what we're going to expect of you. Doctors' offices, we're going to make sure that you get the vaccine that doesn't need to be kept ultra cold. And this is what we expect of you. So the state's moving very quick. We'll be in the 1B tomorrow morning. So that's essential workers and those over the age of 75. We're not really ready or organized for that right now, but certainly it's a bold move by the governor to push us all to start thinking about it.
So I have seen you in action, and I know how good you are at navigating things when they go sideways. What's more important now, that the state gets their act together or that the Biden plan really does work?
No, I think that the state gets it together. We certainly, regardless of what happens with the Biden side and the supply, politicians can tout and make a claim, obviously. The goal is when the rubber hits the road. And so that really gets it down here for us to the state level. And it gets to the needles in the arm. It's easy to make a bold projection that I'm going to do 100 and 100. That's great sound clip. But really now it gets down to what's the organization at the state level and local level. If we have enough vaccine, how are we going to get these in arms as quickly as possible? So, I look at it and say, gosh, I would love for Governor Pritzker to come out and say, here is our plan. Here is the expectations that we have of doctors' offices, hospitals, Walgreens pharmacies, schools, because I see schools as being one of the best mass vaccination sites right now. Most of them are empty. You have large gymnasiums where you could set up many vaccination sites. You have plenty of parking. You could watch people. So you could get thousands and thousands through in the right setting. So I hope that the state gets ready for it, and we just hope that the production continues to be at the level that we can then use them versus them sitting in freezers.
Well, with respect to Governor Pritzker and anybody in a governor's chair and the massive responsibility that is, that plan should have been formulated months ago. I mean, it's been clear forever that Donald Trump and the current administration, we're taping this on Sunday morning, January 17th, so we're 3 days before Biden takes office, but the current administration made it very clear they weren't going to be a help. In a lot of ways, they were a hindrance. Why wouldn't that plan exist on Pritzker's desk right now, and all he has to determine is when he rolls it out and when he announces it?
Yeah, it's easy to be a Monday morning quarterback and to look around, but we have to remember these vaccines were being studied and starting to be produced May and June of last year, and the studies were being done, and we knew that these were going to come out, and we knew that we were going to try to vaccinate all of these people. So disappointing that we didn't have a plan in October, in November. It's discouraging, I say.
It's hard to believe, frankly, because with all the responsibilities individual states have, this has to be at the top of your list. And everyone, Cuomo in New York, Gavin Newsom in California, every governor in the country should have a plan ready to kick it out right now. Are any other states that you're aware of, rolling with this?
Well, look at some of the states now that are doing the general public already, or at least those over the age of 65 or 75, depending on the state. So some have gone to that extreme, and there's some upset because they didn't finish the healthcare workers first. So I'd say it's a mess, but it's one of those where 3 or 4 months from now, when we have this under control, do we have that amount of time? I'm not sure. With the new variant and what's going on and how contagious it is and the spread, and you look at what's happening in some of these states, our focus should be on the vaccination and how we're going to do this most efficiently.
Well, you know me, I don't like to get people fired up and then have nowhere to go with this. So to me, it's as simple as asking your local elected reps and we're talking about Illinois here, from where you live to Springfield and back. Just hashtag, where's the plan? Where's the plan? Where's the plan?
Well,
We want to know where the plan is right now.
Yep, I can tell you, I'm in DuPage County. We have a call with the county, and we have had a call with the county every week, or at least once a week, sometimes twice a week, and sometimes 3 times a week for the past, couple of months. So, I feel that DuPage County at least is getting their arms around it. They're waiting for some guidance. I'll tell you, one of the biggest things is we don't know how we're going to fund the reimbursement for the people that are actually putting the shots in the arm. We don't have an organized plan for people to sign up. It would be nice if that was taken on at the health department level or the state level. We have seniors that don't have computers. We have seniors that don't know how to maneuver around a website, and yet we may use that as an expectation. I think you're starting to see doctors and medical groups starting to step up saying, hey, we'll identify the people. Let's just figure out how we're going to do it. But you still have a large population that may not be affiliated with a doctor that we still need to get vaccinated.
I would argue, too, that at this point, we're all very, very tired of living this way, and tired and scared of the concern that we could still get sick and people we love could get sick and people can die. It's happening every minute of every day. I would argue you'll have volunteers stepping up if you ask for them, and volunteers who are qualified. And if they're not qualified, there ought to be a way to screen them out. In other words, the old cliche, this ain't rocket science. Well, maybe it is, or maybe it's close to it. And I don't mean to make it sound like this is easy. It's nothing close to easy. But this can get done, and it has to get done. And to me, less talking and more action would really be helpful.
Yeah, I can't agree with you more. And certainly you'll get some volunteers to step up. But when you look at the number that we need here, I'm not sure you get the number of volunteers at the time that you need it. And even if we do get the volunteers to get shot in the arms, it still comes down to the logistics of, okay, who's going to run this? How are we going to register these people? What are we going to do? I can tell you the optimism in the medical field right now is so high. The individuals who have gotten their shot and gotten their second shot feel that this light at the end of the tunnel is no longer a car coming, but it's actually sunshine. So we need to get that across. We also have people with vaccine hesitancy that we need to understand why they're hesitant to get the vaccine and to get over that burden. Everybody wants to go back to restaurants and sporting events and that. Well, we got to get to 70% herd immunity before that's even thought of. So when you look at, how are we going to get to 70%, 330 million people in the United States, we're going to have to get 230 million of them vaccinated. That's a lot of volunteer efforts if we're going to consider volunteers. But the organization of employee plus volunteer and a well-orchestrated mass vaccination plan, we can get there. We can get there, and I don't want to say easily, but we can get there.
General Russell Honore, who got real famous for the way he handled Katrina, has been picked by Nancy Pelosi to shepherd the security issues in D.C. We need the Russell Honore of COVID on a national level and a local level. Has that been discussed in meetings on who that person might be?
Yeah, and you absolutely hit it spot on. When you look at the military versus the entrepreneurial side of anything, the military very regimented. They know exactly what they're going to do. They think very logically and put things in place. Now, some people will say they might be slow at doing that, and let's let an entrepreneur, entrepreneurial spirit go out there. It's got to be somewhere in between the two, but you really do need somebody with experience, and the ability to organize is probably the biggest thing. We're talking about a mass vaccination plan that has never been done, but yet we put, armies together to go to war in a very short period of time, very well organized. And then we have others that are brilliant minds that have MBAs from Kellogg that say, hey, give us the guidelines and we can build this mousetrap for you pretty darn quick and we'll make it pretty effective. Look at everything that's been done in industry as far as efficiencies and how quickly we can now even build a car. So putting those minds together with a good military mind on logistics is, I think, exactly what we need to do to get to a point of mass vaccination at the most efficient in the shortest period of time to stop the spread.
Governor Pritzker, I'm asking, where's the plan? Let me get to some basics on where we are with COVID now. And let's go all the way back to the beginning. We didn't know if we needed to wash our groceries. We didn't know if we needed to, spray Clorox or wipe everything down with Clorox. Any of that changed?
No. We look at 99%, maybe even higher than that, of transmission is by airborne, by being in close contact with somebody who's speaking and the virus is coming out of their mouth or coughing and sneezing or that. It is not from getting it on your groceries or touching a pizza box. So that portion of it, we need to make sure that we understand that the mask is much more important than cleaning the surfaces. That being said, washing your hands is very important. Why? Because we cough into our hand, we touch our face, we do all the things where we're helping the virus get there. But I'm not concerned about the orange that's been sitting at the grocery store that somebody may have coughed on 2 hours ago that I'm going to now take and then touch my face and get the virus. So let's just be smart about wearing masks and doing all the things, staying our distance. That's going to get us a lot further than putting Clorox on our lettuce.
Same goes for the Amazon package on the front step?
Yeah, the Amazon package on the front step, especially now, sitting out in the cold. And I tell people, so many people are so concerned. I'm like, that's fine. If you're that concerned, do this. Take in the Amazon package. Take out whatever's in the package. Throw the package away. Wash your hands. The package is now fine. Now, if you're concerned about what's in the package, that was produced a long time ago, so I wouldn't be really concerned. So I think people need to focus and put their anxieties where they should be, which is being in grocery stores and public places with people that they don't know who aren't wearing masks. That's probably the biggest thing.
Even though here in Illinois, in the suburban Chicago and downstate Illinois area, we seem to be catching a bit of a break now. This is far from over, and the last thing we want is for hospitals not to be able to handle the people who need chemotherapy and need to be taken care of on various levels, all the way down to folks who are wondering whether or not they ought to get a shingle shot so they don't also burden the system. What medical stuff should we be pressing forward with now as opposed to stuff maybe we wait on?
Yeah, when we look at basic medical coverage, certainly we should be doing cancer screening as we normally would. So mammographies, colonoscopies, don't let those basic screening go away. We know that we find illnesses early. We should take care of those. So if you're supposed to have a cardiac stress test once a year, get in to have that done. None of these illnesses stop because of COVID. So definitely do all those. If you're looking at the shingle shot or the Pneumovax shot, talk to your doctor, see what your timing is on the COVID shot, because they may want to space those out. We have COVID at the rates that we have here, 10%, 8%, in Illinois, much higher chance of shingles. Although I will tell you that shingles is up just due to anxiety that people have. So definitely talk to your doctor about timing for those. And then again, I would say, we've been very fortunate in Illinois just with our mitigation. So people are upset that restaurants aren't open. I think that you will see, matter of fact, if I'm not mistaken, he did allow that in some of the regions, which totally makes sense. I think actually indoor dining with groups of 4 or 6 are safer than large parties and houses, which we're seeing now, where no masks are being worn and people are staying much closer than a few feet. So definitely something we need to consider.
What about the dentist?
Matter of fact, dentists, it's kind of interesting. Dentists, you would think that they are at the highest risk rate. We have seen extremely low transmission in any dental facility.
Isn't that interesting?
And, yeah. And now, if when you go to the dentist, they'll be protected as much as they possibly can with full PPE. They'll also give you essentially a mouthwash right before you start,
yep, which
will eliminate bacteria and viruses for that immediate portion there. They're being extremely careful. So the dental exposures has been very, very low, which has been great.
Let's circle back to where we began, and this may be a little redundant if you've been with us for the entire conversation. But as of now, in the great state of Illinois, there's no specific way for you to sign up and get in line When would that change? Where's the plan, Governor Pritzker? Anything else we need to know about getting in line, or do we just have to wait until that announcement comes?
Yeah, I would say the biggest thing right now is probably look, for those individuals who have something called MyChart, which is a lot of individuals whose doctors happen to be on a electronic medical record platform called Epic. Look for a note from your doctor or look for an announcement from your doctor, because I think you're going to see the medical staffs taking more of ownership on this. They're going to say, hey, you are next. Here's how you can get it. So look for that. I do think you're going to start to see the state at least have some type of sign up. And again, it's unfortunate that it's unfortunate that we hadn't put this in place already and just be ready to turn it on with the flip of a switch. But I think the biggest thing is going to be, and if you're not affiliated with the primary care doctor, get in with one, because that may be your fastest pathway.
Dr. Kevin Most, Northwestern Medicine, Central DuPage Hospital, and a great source of information always. Glad you're healthy. My best to all that work with you and for you, and we'll do it again. Thanks for being on Live from my office.
Sounds good. Take care. We'll talk soon.
If you're looking to purchase a new home or refinance your existing home, do what I did when I needed the help that Team Hochberg offers. Look, for 20 years, David has built his business helping first responders and medical professionals with their mortgages, and wanted to do more than say thank you. Every week in 2021, Team Hochberg will recognize the first responders and medical pros for keeping us safe and healthy. This week, they recognize Police Chief Steve Castevens, Deputy Chiefs Mike Shaz and Scotty Eisenmenger, and the 63 police officers and 15 civilian support staff of the Buffalo Grove Police Department. Look, to thank them for their service and support seems obvious. And David Hochberg and Team Hochberg have tied in with family-owned restaurants. So Team Hochberg purchased food from Continental Restaurant in Buffalo Grove, owned by Pete Panayiotou. First responders and medical professionals deserve our appreciation, and family-owned restaurants need our support now more than ever. If you can afford to, buy your lunch from a family-owned restaurant for your local police department and fire departments and hospitals. Meanwhile, Team Hochberg will continue doing the same and continuing doing what they do every day, helping me and thousands of first responders and medical pros too, and radio and podcast listeners. But they can't help you if you don't call. Look, I say it all the time. He just wants to save you a little money. 855-56-DAVID, 855-56-DAVID, or 56david.com. Listen, tune in to Home Sweet Home Chicago, the radio show. It's hosted by David, Saturdays at 10 a.m. on AM 720 WGN. Homeside Financial is an equal housing lender. NMLS number 1124061. Back on Live from my office on Wednesday's episode, I will give you my final words on Donald Trump. No, I mean it. I would love for me to not have to talk about him anymore. That's on Wednesday's Live from my office. I didn't say I could guarantee it, but I want those to be my final words. Join me then wherever you're hearing this podcast. And again, rate, review, let us know what you think. And subscribe, please, to Live from my office. I don't want you to miss a single episode. What's good for me is good for you. All right, so a couple of charitable mentions here. With Trump leaving office, one of the most hideous things that happened during his 4 years was the family separations at the border. And regardless of what your politics is or is not, the idea that the dry cleaners would give you a ticket for your coat, but we had no way to properly reunite parents, whether they're legal or illegal, with their children, put us in the kidnapping business. It was absolute ridiculous, awful, and one of the greatest stains on a stain-filled 4-year Trump presidency. So with an unknown number of kids still separated from their parents, family reunification is one of the things done with great work by Together Rising. And somehow Together Rising manages to give every penny of what they do to the cause. Family reunification, again, is just one of the things they do, but they've already distributed millions towards that goal. And there's a lot of expenses in trying to put together and fix the horrible mistake we made at the border that we can never make again. There's also an organization called RACES, RAICES, racestexas.org. They also work hard to make sure border families are taken care of. Remember, the majority of these people that come to our border and seek asylum are doing so because their own Central American countries are too dangerous to live in. So, RACES, Texas, RAICES.org, or togetherrising.org, or if you're so inclined, contribute to both. In the meantime, I thank you for listening to this edition of Live from My Office. Remember, Wednesday, my concerted effort to make it my final words on Donald Trump, really for my own health. I hope you'll listen then. I'm Steve Cochran. Thanks to Ross Cochran for putting this together, as he always does. This is Live from My Office.
30 years plus on the airwaves, you have turned your dial to me. Now you're tuned into my podcast. It's Live from My Office, Steve. From Ithaca, New York, to Carolina South, W. Cochran Steve. From Minneapolis and then Chicago twice, top-rated shows achieved. Sit back, relax, and now listen to my show. When or wherever you are, 'cause you're on the go. A-list celebs with some laughs and great info. Live from my office, the Steve Cochran Podcast Show. Yeah, yeah, yeah. No better place to be. Yeah, yeah, yeah. Subscribe and like for free. Yeah, yeah, yeah. Live from my office, Steve. So glad you're with me. It's Live from my office, Steve.
Thank you for listening to Live from My Office, a service of Monkey Run Productions. All rights reserved. The podcast is hosted by Steve Cochran, and it's mixed, edited, and produced by me, Ross Cochran. Support the show by subscribing wherever you're listening and by telling your friends about it. Follow Steve on all social media channels, including Facebook, Instagram, Twitter, and LinkedIn. And make sure you check out this episode's show notes for relevant information discussed during the conversations. You can also email the show directly at thecochranshow@gmail.com with any questions or comments. And that's the best place to tell us about your favorite nonprofit so we can make sure we mention them on the next episode. Steve is available for corporate speaking gigs. He would love to MC your event. And occasionally, he's funny. Thank you for listening. Head to cochranshow.com for more.